Well, Grove, so federal health officials say if you've already had a booster shot, you don't need another one right now. But what kind of data might change their minds on that?
Yeah, so the recommendations right now is that people who are immunocompromised, who have decreased ability to mount an immune response to the virus, actually should get a fourth dose. But for most of us, that's not necessary right now. And that data comes from both in vitro experiments with neutralization of antibodies showing that antibody levels are good for most people, but also clinical data showing that most people are good with just the first booster dose. People probably may know, several countries have gone ahead with this. So Israel, for example, and Sweden have both gone ahead with vaccinating, with giving a fourth dose to more people, but we're not there yet here in the U.S.
We know that Omicron now accounts for basically all new infections in the U.S. How difficult will it be for another variant to replace it?
Yeah, so Omicron is not quite all right now. We're seeing a few percent of Omicron variants. So Omicron, the official name, BA1. And so we're seeing some BA1.1 and BA2 and BA3. And those do seem to be taking off at some places. And it's perplexing. I would just say that people who are looking at it very closely, I think none of us really know exactly what's going to happen there. But if any of these variants take off, that will change recommendations quickly.
All right, let's get to a couple of questions from viewers, Dr. Colgrove. The first one's from Lana. She wants to know, how do I report side effects from the Pfizer vaccine? I guess this would apply to any vaccine. How do you report those side effects?
Yeah, so this is a really important subject. So when the trials are done, they're usually done with thousands to tens of thousands of people. But when you deploy a vaccine to hundreds of millions of people, you're going to see things that weren't seen in the trial. So it's very important to have a post-approval reporting system. And there are two of these in the US. So I think the most useful one for people, just regular people, is the VSafe system. So V-SAFE through the CDC. And if you go to the CDC and look for the VSafe system, there is a mechanism a cell phone-based mechanism for reporting adverse reactions. And I think that's important to do. The more medical version of this, the vaccine adverse event reporting system, or VAERS, is probably most useful done through primary care doctors or other medical professionals. So people who've had a vaccine reaction should tell their primary care doctor, who can report it to the VAERS system. But I would encourage people to actually report these things, because we need to know that.
Okay, I want to give you another one. This one is coming from Jody, and Jody's asking, can COVID-19 trigger migraines?
That's a complicated question, and so I'm not a headache expert, but my experience here is that all sorts of things can trigger migraines. There are various kind of stressors. There's not anything particular connection between COVID-19 and migraines, but it's an important distinction, because headache is actually one of the more common symptoms of COVID-19. But most people I've seen who have migraines say that it's different than their migraines. That headache is different. And then there are rare serious neurological events that can have headache as one of their symptoms. That's important for the report to their primary doctors, but they're usually not migraines. But people with migraines will say that stressors or all sorts of things might trigger them. COVID-19 is certainly among them, but I don't think there's any specific connection.
All right, Dr. Robin Colgrove, we thank you so much for your time, as always, and your insight.
Always happy to do it. So.
Thank you. All right.